Now let's talk about a short topic which is tumor markers, and this will be coming as a 2 marker in our university examination. So what are the things that you have to write for tumor markers? Small explanation about tumor markers. They are biochemical indicators. They are biochemical indicators of presence of a tumor. They are the biochemical indicators of presence of a tumor, and they are not used for primary pathological diagnosis. These tumor markers are not used for primary pathological diagnosis. What they are having prognostic value. They are of prognostic value, and the presence of tumor markers signifies recurrence or residual tumor. So these are the 4 points that you have to write about if it is asked what are tumor markers and what is tumor marker. They are biochemical indicators of presence of a tumor, and they are not used for primary pathological diagnosis, but they are of prognostic value, and presence of these tumor markers signifies recurrence or residual tumor. And then you have to write different examples for tumor markers, and these tumor markers can be categorized into category 1, 2, 3 and 4, and there are examples for each category. So for remembering the category, you can memorize a mnemonic like HOMI, HOMI. H for hormonal, O for oncofetal antigens, M for mucin and other proteins, and I for isoenzymes. So HOMI, H for hormonal, O for oncofetal antigens, and M for mucin and other proteins, and I for isoenzymes. This table I have taken from SRB, so we can go through it. Once I will just explain under each category. For hormonal, human chorionic gonadotrophin (HCG), calcitonin, catecholamines and vanillyl mandelic acid, ectopic hormone. So HCG, human chorionic gonadotrophin, it will come under trophoblastic tumor, non-seminomatous testicular tumor, etc., etc. I think this part is not that much necessary. 1 or 2 things you just remember. This tumor marker is for which tumor and all. Calcitonin you can easily remember, medullary carcinoma of thyroid, calcitonin, thyroid. Pheochromocytoma, catecholamines and VMA. Ectopic hormones, any paraneoplastic syndromes, ectopic hormones will be elevated. So hormonal category, you can remember HCG, calcitonin, catecholamines and VMA. Ectopic hormones, paraneoplastic syndromes, ectopic hormones will be elevated. And coming to the second one, O for the third category here, oncofetal antigens. That we know from our secondary itself, oncofetal antigens, alpha fetoprotein and carcinoembryonic antigen. Alpha fetoprotein will be seen in liver cancer, non-seminomatous germ cell tumor, etc. And carcinoembryonic antigen, that is seen in carcinoma colon, carcinoma pancreas, lung, stomach, breast, etc., etc. So first one is hormonal category, second one is oncofetal antigens, third one is mucin and other proteins. Even that we know, CA125, that we are listening from a second year pathology, CA125, that is elevated for ovarian cancer, CA15-3 breast cancer. CA125 is for ovarian cancer and CA15-3 is for breast cancer, as CA19-9 is for pancreatic and colon cancer. So mucin and other proteins, 3 things we have to remember: CA125, CA15-3 and CA19-9. Then coming to the last category, that are isoenzyme. Isoenzymes are prostatic acid phosphatase and neuron specific enolase. Prostatic acid phosphatase, you can remember it as PAP, prostatic acid phosphatase, that is elevated for carcinoma of prostate gland. Neuron specific enolase, that is for small cell carcinoma of the lung and neuroblastoma. So I think now you guys know what are things to write if tumor markers are asked as a 2-marker. Just to explain what is a tumor marker. It is in this slide I have mentioned that they are biochemical indicators of presence of a tumor. They are not used for primary pathological diagnosis. They are of prognostic value actually, and this presence of tumor markers signifies recurrence or residual tumor. And then what are the tumor markers, examples, and in which condition it is elevated. So categorically we can write it for better marks and all. So first is hormonal, second is oncofetal antigens, M for mucin and other proteins, and I for isoenzymes. H hormonal, we know human chorionic gonadotrophin, calcitonin, catecholamines and VMA. Ectopic hormones, HCG, we know trophoblastic tumor, HCG. Calcitonin, medullary carcinoma of thyroid. Catecholamines and VMA, pheochromocytoma. Ectopic hormones, it should be elevated in paraneoplastic syndromes. Coming to the oncofetal antigens, alpha fetoprotein and carcinoembryonic antigen. Alpha fetoprotein, liver cancer. Carcinoembryonic antigen, colon cancer, pancreas cancer, lung, breast, you can write whatever you want. I think most of things C, E, A will be elevated. And then coming to the mucin and other proteins, CA125 we know ovarian, CA153 we know breast, and CA99 we know pancreatic and colon. And then coming to the last, isoenzyme, prostatic acid phosphatase, that will be elevated in carcinoma prostate, neuron specific enolase, NSE, neuron specific enolase, that is seen in small cell carcinoma of the lung. That's it. So thank you guys, thank you for your time.